I came to El Paso in 1985, and about a year or so later, I was at a dinner party with Lupe and Freddie de la Vega. And when Lupe de la Vega heard that I subspecialized in pediatric orthopedics, she enthusiastically cornered me, and we talked about what she was doing in Juarez, and would I come over and see what she was doing, which I responded to positively, and went over and saw the small clinic facility that she had built at that time. So we toured the facility, and that's how we got started. And now we have several exam rooms that we share with other providers that are there in the clinic at the same time. And now we have an excellent functioning x-ray facility compared to where we started. And so, yes, things have certainly changed if you go to the clinic now to compare to what it was like over 30 years ago.
You to come to Juarez every month for over 30 years.
First of all, I get more out of it than I give. Through the Juarez Clinic has been life-changing for me. I feel that it's important for all of us who are capable to give back to our communities in any way or fashion that we are able to do. I think being able to share my knowledge and experience and be able to take care of the children in northern Mexico area has been something that has made me feel that I am doing something important with my life.
What made you persist through the worst of it?
It was the people. Families needed to know that no matter what, we were there for them. We may not have seen as many children as we were seeing when things were present prior to the violence, but I wanted everyone to know that we had not given up on them, not only for them, but for the entire community, that the people know that we weren't just there just for the good times, but we were going to be there and stand with them and support them even in the worst of times. At this clinic, we take care of children mostly that have long-standing chronic issues. Children with special needs, cerebral palsy, myelomeningocele, which are specific conditions that are most commonly seen in the pediatric population. But we also see unique things of tumors, unusual infections, chronic infections, limb deformities. ¿Cuánto tiempo después de la operación? There are certain conditions that I just cannot manage because of the time frame of needing to see them on a more frequent basis, once a week for sometimes up to several months at a time. And those children we've been able to bring to the office here in El Paso and be seen in my office. Surgical cases I do here in El Paso. Anything that is something beyond a simple office procedure, I do here in El Paso with the assistance of Providence Hospital.
You see them for a consult and then they move on to different kinds of therapy?
The majority are children that I continue to see for as long as they're capable of coming in to see me because of the nature of the conditions that they have. And when I say I, it's really we, physical therapy and orthotics, prosthetics, will continue to follow these children into their early adulthood years to help with their management of their orthopedic conditions. We have approximately 50 or so patients in the clinic that are seen between the three of us. That's been about an average number lately. It's been in the last probably couple years. I would say it's stabilized. When we first started, before the violence, there may have been 75 to 100 kids. And now I would say we're around 50 to 60 children.
What else do you think you need?
Well, we have recently been provided with X-ray access systems to have faster access to our X-rays that are done in the clinic on computer monitors, rather than the old-fashioned way, which is on film, which is what most people may have remembered in the past of what it used to be like, and still is. That's something that we've had some issues with, the electronics of developing that. It would be helpful for all of us. We are always in need of equipment for our children who are special needs, wheelchairs, walkers. Many of the patients are receiving reused equipment. I've received equipment from as far away as California that has been brought over here by truckload to be used, or reused, I should say, in Juarez for our patients.
So I met Dr. Heydemann when he spoke at my physical therapy meeting, and went up and introduced myself. And he, shortly after that, asked me if I'd like to go to the clinic that he was doing in Mexico, and I said I would. So I went one time with him, and ever since, I'm still going. It was a little scary because it was Fabian, Dr. Heydemann, and myself, and we would walk over the bridge, and it was totally deserted. And at the bottom of the bridge, you saw all of the military persons with their AK-47s, and we would see trucks with soldiers in them. But it's a short walk from the bridge to the clinic, and we were fine. When we practice, we have certain experiences, and I think being in the clinic has given us other experiences because we don't have all of the fancy things that we have on this side of the border to work with. So it makes you use your creative skills to treat the children. And when you only have 5 or 10, sometimes 15 minutes with the kids, you learn to triage and figure out what is the most important thing I can do for this family, this visit, what will make a difference. And the thing that I've found is the families are very cooperative and are very willing to do what you ask them to do. And when they come back for their follow-up visits, they have carried out what you asked them to do, on the most part. The area that we're in right now, we've probably been in the longest. The mats on the floor help. And when we get the kids down on the floor, because we don't have to work on concrete floors anymore. I just remember how many people were in the waiting rooms. It was like there was no end to the amount of people in the waiting room. And that hasn't decreased over the years. The wonderful part is that we've seen some of the kids grow up. We've seen some of the children go to college. They've come back to tell us how they're doing, and that's been very rewarding. I know that we didn't even have X-ray capabilities when we first started, so Dr. Heydemann used his clinical skills and was able to create a plan for the children using his diagnostic skills. And there were many times we really didn't know diagnoses of children, but it has really been an experience. I have seen diagnoses that I probably would not have seen in El Paso. We've seen children with polio, which was pretty much extinct when I started practice. But it has, the conditions have continued to improve, and with the addition of braces and the walkers and the wheelchairs, that has helped because it lets us give the patient something that they can use to carry out what we do in therapy. So.
The clinic would do so very well if we had access to knee mobilizers, hip braces. The hip braces are items that we use a lot of because we are so blessed to have Dr. Heydemann do so many hip surgeries. But after these hip surgeries, the children need to wear a brace. Those braces are extremely expensive. That is definitely an item that if we have an array of them, if we have 4 smalls, 3 mediums, and 2 larges, then they can be reused, because then the pads can be taken off of them and we can get brand new pads as opposed to the entire brace, and then reuse them with the next child that needs the same brace. Walkers would be wonderful to have. They are, from the equipment outside of bracing, they're probably the least expensive of the items that we can get, and they are probably the ones that can make the most difference in the community, because there are so many children that need them. The kids don't have to pay for any of the care, at least not the care that we provide at the orthopedic clinic. The way we are able to provide, or at least the way I am able to provide that care for the children, is with the donations that I get from the kids that I take care of here in El Paso. So they donate their braces, they donate their wheelchairs, their walkers, their standers, and all of those end up in Juarez. For example, sometimes we have donations of very specialized equipment, standers, for example. A stander won't fit in a lot of these kids' houses, their homes. They simply don't have enough room for these pieces of equipment. So what we do then is we will donate those to places that can use them, not only on one child, but on a lot of them. We've donated equipment to Ojos de Dios. They have been doing a wonderful job with the therapy for a lot of the kids that we take care of. We have donated equipment to Villa Integra as well. We have donated standers. We have donated gait trainers. I mean, we're talking $5,000, $7,000, $8,000 pieces of equipment that if you try to acquire those for a specific child, it would be impossible. But by getting those to a place instead of a child, then a lot more children can benefit from that. A great number of those braces we make here in this office, and then we fit them on children in Juarez. But yes, a lot of those braces that come out of my office, that's just something that I donate for the provision of these children. Well, the process is definitely going to start with Dr. Heydemann. He's the boss. He's the man. So he's going to evaluate the child, and then he is going to determine what the child needs. From that point, the child can either go to me, or I can go to Dr. Fisher or one of the other therapists that are going to be in the clinic for whatever services they need. Most of them are going to need both. So they can either go to therapy, then come to me, but most of them are going to come to me first, because we need to brace the children. We need to provide them with the mechanical support that they need to be able to then do the therapy. So that would be basically the flow that I would say that the clinic has. There are so many places that don't have what we have. And the results that we get with these children, with the limited resources that we have, is second to none. That they're not any worse on that side of the border than they are on this side of the border. So the results we have are excellent. And that's really the only thing I can think of that could be different. If we had more resources, we could do so much more for so many more children. That's it.